Hi, this is Kurt Kasanowski from Hospice Advisors. How are you? I'm here to talk about our weekly case study post. And this is a real interesting one, folks. I've actually written a few articles on this, and it's looking at creating a partnership with long-term care communities to bring more value. So the presenting problem in the specific community, and this was one that was in Texas, is that this super SNF, as I call it, it had 11 hospices in the community working in their four walls. It had 13 home health care companies and 9 private duty personal care companies, all working in the super SNF to gain a referral. And as I got to know the executive director, I sort of started talking to Blake about the value of looking at minimizing all the folks that are in his building working simply from a variation standpoint on how care was delivered, but more importantly, as he prepared for the accountable care organization movement, is to be able to produce good quality data. And so what we ended up doing was sort of agreeing that made sense, and Blake took the bull by the horns and issued basically a little edict and told all the folks that were in his building he was going to be putting together a little mini request for proposal to look at establishing 3 providers in each category: home care, hospice, and personal care. So those 3 per category, that would be groups that would be working as his team. He wouldn't prevent other people or other organizations that had a patient or client coming into his building to come in and provide care. It was, but those 3 organizations per category, or those 9 teams, or those 9 groups in total, would work together as part of this super SNFs team to work on quality care access and some of the other issues that were important for Blake and his senior community to shine in the eyes of the healthcare community. So that was sort of the approach. There is, at the very bottom of the video and the narrative, there's a matrix, and it's a value proposition matrix, and Blake utilized this matrix to basically go by and determine which of the 3 home care, which of the 3 hospices, which of the 3 personal care companies he would select. So that's for your information is below. So bottom line is he came up, and it was an arduous process. If you want to learn more about the nuts and the bolts and how it went, give me a buzz. But he did come up with his 3 providers per category. And as a result, some of the outcomes is that we really worked together, and I was one of the hospice groups that was involved. We really worked together better as a team to prevent readmissions back to the hospital, which was huge. We were able to really look at how we could establish new ways of generating revenue. And as a hospice, I worked with Blake to look at developing a general inpatient hospice cluster bed program in his facility. And there again, the narrative's below. But it really helped bring in new revenue to the facility, as well as help provide another tool in his shop's toolkit to help keep people safe, secure in his facility without having them to have to be readmitted to the hospital. And more importantly, we were able to actually collect data that we were able to proactively go to his referring hospitals with, and the hospitals loved it. We gave them more than they needed and wanted, and they actually loved that. And then the 3 personal care companies that were in there were really cool. They actually ended up developing a collaborative working relationship. They actually got a little small office. They sort of shared the work, but really worked to keep people safe in the facility if needed. But more importantly, if they went home and were in need of personal care services, they were able to provide those professionals and the expertise to keep people safe, secure, and at home. So it was a very, very cool and very, very successful case study. And more importantly, for the hospice group that I was part of, we became known as sort of the thought leaders in the community around looking at innovation, around dealing with some of the challenges presented in today's healthcare environment. So with that, I hope you enjoy the case study. Feel free to call me if you have any thoughts or comments. And with that, I wish you a good day. Take care. Bye-bye.